Hello and welcome to this series on hand calculations. In this video we're going to be discussing the electron formalism, and specifically we're going to be talking about electron profiles. So why do we need electron profiles? We know that electron treatments typically are prescribed to the central axis, so there's no really use for them for the purpose of a hand calculation. But we do need to know what they look like because their shapes are important for treatment planning and also have implications for field matching. So we need to know what they look like for the purpose of treatment planning, but for the purpose of a hand calculation, there's really no reason why you would need to use a profile because you don't need an off-axis ratio because it's always prescribed on the central axis. But we are going to go ahead anyways and look at some profiles. So here's an example electron profile. So this just shows the isodose distribution with respect to depth, and this is for a 20 MeV electron beam, and you can see that the higher isodose lines, so if you look at the like the 95 and the 90% isodose lines, they tend to constrict inward, away from the periphery of the field as you go deeper. And on the contrary, if you look towards the lower isodose lines, like the 30 and 50, those actually tend to balloon outward. And so we kind of get this weird behavior of the high and low isodose lines, with the higher isodose lines tend to constrict in, and then the lower ones tend to balloon outward. This is important for treatment planning. Let's say you had a target that was 3 centimeters in diameter and you wanted to cover it with the 98% isodose line. So you would actually need a cutout that was slightly larger than that 3 centimeters, due to this behavior that we're seeing here. Because the isodose lines are constricting inward, you actually need to compensate for that by having a larger cutout. So that's just something you need to consider when designing an electron cutout for a treatment using an electron beam. So I mentioned before the concept of field matching. So this is an example of that here. On the left, you have a 6 MV photon beam. You can see it's nicely defined with sharp penumbra, deposits dose relatively deep. And then on the right, you have a 20 MeV electron beam that is matched at the surface to the photon beam. So what that means is that the surface or the field edges of these two fields are matched at the surface. And what you see here is that in the photon field, there's a large hotspot on the side that is matched to the electron field, and that's because of the ballooning of those lower isodose lines that we talked about. And because those isodose lines are ballooning out, you're contributing additional dose to that side of the photon field, resulting in this hotspot that you see here. And so if you are trying to match a photon field to an electron field, you need to take into account the shape of these electron profiles in order to give yourself an effective match and to lower the dose in that superficial region on the photon field side. And that is all I have for electron profiles, so thank you so much for watching.